Hi, this is DrRic with a tutorial on herbs for depression. Depression can be either mild, moderate, or severe, or something as easy as seasonal affective disorder. And I've spoken in the past about SAD, but for the winters in Chicago, right now it's October and it's overcast, but it's still pretty warm. So this kind of day is going to be here probably for the next 3 to 6 months. Sometimes if you're on the fence as far as feeling a little bit sad or depressed, then this kind of environment, when you're exposed to it every single day, will put you off the fence, either into a more severe form of seasonal affective disorder or a more severe form of depression. Hopefully you'll be in contact with a primary care doc or someone of a healer that can help you through those times, including counselors. But for the sake of the discussion, we'll talk about my top 3 picks for mood stabilizers in the herbal world. Now, these aren't just popular because they're moving off the shelves of Whole Foods or Fruitful Yield. There have been studies time and time again over the last decade to 2 decades showing the improvement with mood in their use. The first one we'll talk about is SAMe, S-A-M-E. SAMe is great, but it does take a while, and most people, when they come to see me, don't want to wait. A while would be about 3 months before you'll notice any great differences. The beauty with SAMe is that it also has been shown to be an excellent medicine for decreasing pain from joints. So in some major studies, 3 months of use, going from 200 milligrams twice a day up to 1,400 milligrams twice a day, will increase range of motion in arthritic joints. Now, there is question on what happens in the joint as far as the anti-inflammatory effect. Truthfully, it doesn't matter. Even if there is positive proof on a biopsy, you have people that say that they do better. So, the one caveat is, again, that, well, I should say, if you can tolerate the waiting time, 2 other problems would be the price. SAMe really has to be individually wrapped. Each capsule has to be wrapped or in a tinfoil push dispenser, because the exposure in a bottle would usually, to oxygen or atmosphere, decrease the effectiveness of each capsule. So individually wrapped makes it very important. If you have something in a bottle, not individually wrapped, probably not worth buying. SAMe also has been known, if there is any hint of bipolar disorder, it can increase that expression while you're waiting for it to help with the depression. So you certainly don't want to have one side effect to get a better effect on the depression. Might be something to avoid if there's a history in the family. So SAMe, excellent. Also good with joints if the price is affordable and if you can wait up to 3 months. Sometimes you'll have results even sooner, but for the most part, my patients either can't afford it over the 3 months or they don't want to wait. So, excellent choice. Second on my list is 5-HTP, 5-hydroxytryptophan. And I use it more for patients who have a anxiousness accompanying the depression, like poor mood, no joy anymore, but can't seem to relax, can't sleep properly, always worried. And for that, 5-HTP is great. Usually you'll start off with 5 milligrams once or twice a day, and then increase to about 100 milligrams once to twice a day. Doing that for about a month, you should see some good results. I sometimes use it to help patients get to sleep at 50 to 100 milligrams at night, in addition to other things for sleep. But 5-HTP is great. The only problem is in the 80s and 90s there was a scare with tryptophan by itself. It turns out that people were getting eosinophilic myalgia, so all these body aches and fatigue, and that was traced back to a batch of tryptophan that came from Japan. It was found that they had something called peak X in the tryptophan. So if you're going to use 5-hydroxytryptophan, make sure it's checked for peak X. Always important. And peak E, but peak X, if you can ask your bottler or manufacturer, it may be important. The final will be St Johns Wort, which is my favorite. Easy to use, relatively cheap, you can get it anywhere, and it ramps up pretty fast as far as its effects, again for stabilizing mild to moderate depression. St Johns Wort is usually started at 300 milligrams per capsule, twice a day to 3 times a day, and that too is ramped up to 1500 milligrams, divided into 2 to 3 times a day. St Johns Wort is very well tolerated, less side effects than Zoloft, and relatively cheap. You have to be careful if you're a chemotherapy user or if you're on warfarin, a blood thinner. Sometimes it'll interfere with that. Otherwise, St Johns Wort is one of my favorite. The one thing with St Johns Wort on the side of the bottle, you want to make sure that it's standardized to something called 0.3 piperacin and 3 to 5 of hyperforin. Those are the 2 active components that should be the ingredients on the side of the bottle. So check for those 2 things, and I'll list them on the YouTube link. Don't ever forget that it's always important to get into counseling and get some help from a professional.